Hello and welcome to part 4 of abdominal anatomy. In part 4, we are going to talk about organ placement because all of our abdominal organs lie somewhere in the peritoneal cavity. Specifically though, some lie within the peritoneal cavity, which we describe as intraperitoneal. Some of our organs lie behind the peritoneal cavity, which we call retroperitoneal, and some lie below or under the peritoneal cavity, and those are infraperitoneal. So retroperitoneal organs, we'll start with that one first, are closely associated with the posterior abdominal wall. So they are posterior organs, okay? They're less mobile within the abdomen compared to the intraperitoneal organs. Examples of retroperitoneal organs are kidneys, ureters, adrenal gland, the pancreas, the C-loop of the duodenum, the ascending and descending colon, the upper rectum, the abdominal aorta, and the inferior vena cava. Now, all of those are listed in your book, and we will identify them together in class as well. But I would recommend that you get comfortable with organ placement because you will see exam questions on organ placement in the abdominal cavity. Infraperitoneal organs, again, are located beneath or under the peritoneum, and examples of those include the lower rectum, the urinary bladder, and the reproductive organs. Again, these can be found in your book. Here is a sagittal image of the abdomen showing the relationships between the peritoneal cavities and the infraperitoneal organs. So let's take a look at this. Remember, all of this is your peritoneal cavity, okay? Some structures are within, some are behind, and some are below. Well, look here. The bladder and parts of the sigmoid and rectum here are under or behind the peritoneal cavity, okay? Look at our major blood vessels. They would be behind the peritoneal cavity. And oftentimes when our patients are, I'll use the kidney as an example. A patient will sometimes come in and say they've got back pain, and we call that flank pain. Well, that could be coming from a retroperitoneal organ. So think about like a kidney stone. Those patients have flank pain. Okay, organs that are within the abdominal cavity that are partially or completely covered by some type of visceral peritoneum, but are not retroperitoneal or infraperitoneal, should be referred to as intra or within peritoneal. Okay, so let's say that again. Organs in the abdominal cavity that are covered by some type of peritoneum, they're not below or behind the peritoneal cavity, we call them intraperitoneal. Okay, and on this diagram, the intraperitoneal organs have been removed, but you can see them here. Liver, gallbladder, spleen, stomach, jejunum, ileum, cecum, transverse, and sigmoid colon. So all of those organs are within the peritoneal cavity. I did want to point out one significant difference that exists between male and female peritoneal structures. The lower aspect of the peritoneum in men is closed. It's a closed sac or membrane. But in females, the peritoneal sac is open to allow for the uterus, fallopian tubes, and ovaries to pass up into the peritoneal cavity. In males, the lower peritoneal sac lies just above the bladder, totally separating the reproductive organs from the organs in the peritoneal cavity. Okay, so just know that in men, the peritoneal cavity is closed and it ends right above the bladder. In women, the peritoneal cavity is open to allow passage of the uterus, the fallopian tubes, etc. Okay, really important, as I said a few minutes ago, you will be tested on these organs, so please be familiar with which organs are retroperitoneal, which are infraperitoneal, and which are intraperitoneal. And we will practice with this in class, okay? Okay, in order to help us describe the locations of various organs in the abdominal cavity, we use a quadrant or region system. There are 4 different quadrants that we can use and 9 different regions. So let's start with quadrants. So if you draw 2 imaginary lines that intersect through the belly button, or we call that the umbilicus, they would divide the abdomen into 4 different quadrants. The horizontal line is approximately at the level of the belly button, or the umbilicus. This also corresponds to your L4, L5, so your 4th or 5th lumbar vertebrae. It's also the same level as the iliac crest. See, here's iliac crest here, the top of the pelvis. So that horizontal line, again, think of it at the level of the umbilicus. The vertical line that you see runs down mid-sagittal plane. And the quadrants are therefore the right upper quadrant, left upper quadrant, right lower, and left lower. And we use this quadrant system to describe the location of pain and other symptoms when we're doing abdominal exams. So again, it's important that you're familiar with which organs are in which quadrant. Okay, so the appendix coming off the cecum would be right lower quadrant. Okay, so patients that are having appendicitis are going to come in with right lower quadrant abdominal pain. And you would write that down for your radiologist. Okay, so we have 4 quadrants, but we can further divide the abdomen into 9 regions. Now, technologists, such as ourselves, we should be familiar with the 9 regions. However, in general, we typically use the 4 quadrant system. So in practice, we use the quadrant system. It's usually sufficient for describing pain or other symptoms. But I'll give you a diagram that will help you label these 9 regions. Okay, so you could see that the liver takes up the right hypochondriac region. The appendix would be in the right inguinal region. Number 5 is the umbilical region. That is your level of your belly button. Number 2, this is epigastric. I use epigastric in a clinical setting because patients that are having gallbladder pain often describe it in that upper medial region. So it's epigastric. So I could tell my radiologist my patient has epigastric abdominal pain, and that would tell the radiologist exactly where that pain is. Okay, let's discuss some topographic landmarks. We learned some landmarks with chest imaging, so I also want you to be familiar with landmarks for abdominal imaging. Most of our abdominal organs cannot be palpated, right? Like I can't feel a kidney, I can't feel a stomach. So these landmarks help us to image those body parts. Now, when you are palpating for these landmarks, just be gentle. Don't hurt the patient, of course, and it's not a bad idea to inform the patient of the purpose of palpating before you begin. So you could just say, Mr. Smith, I'm just going to poke a little bit here so I can find my location. Okay. There are 7 palpable landmarks that help us position the abdomen. First, the xiphoid process. That is, remember, the most inferior part of the sternum. It's labeled number 1. Xiphoid corresponds to the T9, T10 vertebral level. And the xiphoid is handy because it approximates the superior and anterior portion of the diaphragm, which is also the upper or superior margin of the abdomen. So in other words, the xiphoid kind of approximates the level of the diaphragm, which is the top of your abdominal cavity. Number 2, the inferior costal margin. That is, costal refers to rib, by the way. That is approximately the level of L2, L3, and you can see that on your diagram here. That landmark is helpful because it will help us locate organs such as the gallbladder and the stomach. So in other words, the stomach is corresponds to the level of the bottom of the rib cage. Okay. Number 3 is iliac crest. That is the top of the pelvis. You can see it here. And that corresponds to the L4, L5 vertebral level. This is the most commonly used abdominal landmark, and it really corresponds to the center of the abdominal pelvic region. Here is a list of the remaining topographic landmarks: ACIS, greater trochanter, symphysis pubis, and ischial tuberosity, and their locations are drawn on the model. I'd like to discuss these in further detail on the next slide. We just have a much nicer, bigger drawing here. So the fourth topographic landmark that I want you to be familiar with is the anterior superior iliac spine, and we call that ACIS. The ACIS is a large bump distal to the iliac crest. So here's crest. If we go distal, there's the ACIS. This landmark is most often used to help locate the iliac crest. I think when a patient is supine, the ACIS really sticks out nicely. So I will begin by palpating ACIS and then walk my way up to find the crest. And remember, the crest is helpful because it indicates the center of the abdomen. So that is a helpful positioning landmark, and we'll learn about that in lab. The fifth landmark I want you to know is the greater trochanter, right here on the femur. This landmark is more easily palpated on thinner patients, but it is handy if you can feel it. The greater trochanter is located at approximately the same level as the pubic symphysis. See, they're kind of level here. And the pubic symphysis must be included on our abdominal radiographs. So we'll talk more about that in lab. The sixth landmark I want you to be familiar with is the pubic symphysis. The pubic symphysis is the anterior joint of the two pelvic bones. So here is a pelvic bone, and here is a pelvic bone, and they join at the pubic symphysis or symphysis pubis. This landmark is important because it corresponds to the lower margin of the abdominal pelvic cavity. Now, you can actually feel or palpate pubic symphysis. However, typically we refrain from that as it can make your patients uncomfortable, as you can imagine. The seventh and the last landmark that I want you to know is the ischial tuberosity. Okay. This landmark is used when patients are prone, and it indicates the bottom margin of the abdomen on a PA abdominal radiograph. Now, AP abdominal radiographs are most common, but you could do a PA. The ischial tuberosity is really our butt bone, if you know, to speak in layman's terms. It's the part of our pelvis that bears the most of our weight when we're seated. So it's like that bony part of your butt when you're sitting down. The ischial tuberosities are about an inch below the pubic symphysis. Again, you can see pubic symphysis here. Here's your ischial tuberosity. And palpating that region may be uncomfortable for patients, so we typically don't. So we typically try to use other landmarks if we can. We're going to study the pelvis in great detail in semester 2 after winter break, so more to come on that. And this slide concludes our abdominal anatomy recorded lectures. Thank you so much, and let me know if you have any questions.